at Riverside Park in AZTEC. Music from Big Patty, Smelter Mountain Boys, Patrick Crossing and Devil's Dram, and featuring the Highland Games Athletic Competition. Plus, Scottish vendors, food, and clans. Find out more online at aztechighlandgames.com. KSJE is supported by San Juan Regional Medical Center, here for you, providing safe, quality care. Stay informed on the COVID-19 developments to protect yourself and your loved ones at sanjuanregional.com or the COVID-19 information line at 505-516-0938 or 888-949-5387. San Juan Regional Medical Center, caring for the Four Corners since 1910. 11 minutes past 8 o'clock. It is Friday morning, the 10th day of September, 2021. Good morning, everyone. I'm Scott Michlin. Thanks for joining us this morning on KSJE. Coming up in just a moment, it is our COVID-19 Community Information Program. Every other week, of course, we are presenting the latest information about COVID-19 here locally in San Juan County. Our guest today, Dr. Brad Greenberg from San Juan Regional Medical Center. Megan Cullip will be joining me in just a moment for that program on KSJE. Then, of course, next hour, Mick Hess will take us roving with the arts, and this morning, Mick is featuring music from Johannes Hummel on the program. That starts after the news at 9 a.m. on KSJE. And today at noon, it's the Cop Shop with the Farmington Police Department. Farmington Police Chief Stephen Hebby will be here, Public Information Officer Nicole Brown. That's coming up today at noon on KSJE. Of course, you can listen on the radio or watch us online on our YouTube channel or Facebook page or our Twitter account as well. And don't forget, in addition to all those social media platforms, you can also follow KSJE on our Instagram page as well. And if you're a podcast person, a friendly reminder that KSJE podcasts are on all major podcast platforms like iTunes, Spotify, iHeartRadio, Google Podcasts, Pandora, and of course Podbean, our hosting platform. You can access those through your favorite podcasting app. Go to our website for more details at ksje.com.
Good morning, everyone. I'm Megan Cullip, along here with Scott Michlin.
Good morning. It's Friday. Yet again.
Yet again.
We always see each other on Fridays.
That's like the only time we see each other now.
I know. But it gets you through your week, doesn't it?
Yes. Counting down the days.
Okay, there you go. Welcome, everybody. This is our Friday COVID-19 Community Information Program from KSJE. As you recall, we are swapping every other week with our Solutions from the Street program and our COVID-19 program because COVID is still here.
Still here.
And back.
I know,
it's back.
Well, yeah, it's surging again is maybe the way to put it.
That's a way to put it, sure. So anyway, but we have some guests on the program today. We'll be talking to in just a moment. Dr. Greenberg from San Juan Regional Medical Center is going to be joining us with an update on conditions at the hospital and some other things, of course, that have been in the news this last couple of weeks since we talked to him last. So we appreciate his time. And we'll be sharing some other local numbers and information about San Juan County cases and things of that nature. And we got some updated numbers by zip code as well. So we can see how communities are doing. So that's the plan for today. What do you think?
I think that's a well-needed plan.
Okay. I hope
lots to talk about.
We got a plan. So
yeah, we just need a voice of clarity. So super happy that Dr. Greenberg's here.
And it's neither one of us. So that's why we invited Dr. Greenberg.
We brought somebody in. Yeah.
So there you go. Who is here now, right?
Yes.
So let's talk to him. Dr. Greenberg is joining us by WebEx this morning from the hospital. Dr. Greenberg, you can hear us all right? We can hear you, hopefully.
Indeed, Scott. Thanks so much for having me.
You bet. Good morning, and thank you for being with us. And so let's get started by maybe talking a little bit about conditions at at San Juan Regional these days? How are things doing?
Well, I have to say we are in the midst of our fifth wave. The state of New Mexico has had increases in cases for some time. We're watching it very closely. And the total number of cases we've had since the beginning of this pandemic in San Juan County is up to now 17,402. We've been following our COVID cases in the hospital very closely. We're up to 33 COVID cases with 2 PUIs presently in our facility, and also seeing a very high number of cases, both COVID and non-COVID, requiring the ICU. We have 12 COVID patients in the ICU now, and a total of 19 patients that require ICU level of care. Now, keep in mind, we only have 14 ICU beds, and so we're working with with a great staff here to make sure that we're providing superior care, and have opened up a second intensive care unit, which we've had open intermittently for the better part of 2 years now. And so we're continuing to follow this very closely. We're back on the patterns of making sure we have enough supplies, including respiratory equipment like ventilators and non-invasive ventilatory devices, because we're using increasing numbers of those items. Also keeping very close track of what's happening with the resources that we have available to take care of these patients, including things like pharmaceuticals, but most importantly, really looking at how we'll have enough people to manage the increased number of these cases. And so it's been a challenge where we've now done this, a few times over, and so everyone knows what to expect. And I hope everyone can feel confident that their local facility is doing everything possible to make sure that we remain prepared and available for care, both COVID and non-COVID, to make sure that we can take care of residents in the Four Corners.
That's good to know, Dr. Greenberg, and thank you for that. I wanted to ask you, too, I know before in some of these surges, we'd heard talk about maybe some elective surgeries being postponed at the hospital and some of those decisions being made, which may be a higher pay grade level than you. But have you heard anything about that, or expanding the COVID unit and things like that in preparation for more patients coming in? Can you give us an update on any of those things?
Absolutely. I mean, we are actually, when we had a larger number of patients, COVID patients during the previous surge, we peaked at 100 COVID inpatients. So we have considerable depth at this time. Now, 100 COVID inpatients is a really, really large number. And so when we're discussing how to manage these patients when it comes to space, the equipment, and the personnel associated with it, all of those elements that you just discussed are on the table and actively discussed. Is it the time to reduce elective surgeries? Should we try to relocate or reassign certain personnel? All of these things are discussed on an ongoing basis to make sure that we can adjust our posture to make sure that we can meet the needs. So, we haven't had to make substantial modifications to our operating room scheduling, and we're trying to find resources elsewhere within the facility to make sure that we can ramp up certain things, like, for example, our monoclonal antibody infusion clinic ramped up yesterday, now with the ability of seeing 6 to 8 patients per day. But we're relocating and reassigning folks, but not from some of those areas. So we have not yet had to curtail any kind of elective procedures at this time. We are, though, seeing considerable increases in some of our urgent and emergent outpatient services, and with some record numbers in both the urgent care and also very high numbers that have been sustained within the emergency department. And notably, those have been accompanied by increases in the proportion of those patients seeking care that have influenza-like illness, which is like a marker for COVID-like illness. 16% of those patients in the emergency department have had influenza-like illness, and really remarkably so, 47% of those patients seeking care at the urgent care center have demonstrated influenza-like illness as well. And we look at our 7-day and our 14-day averages of our percent positivities, and those are also kind of trending upwards and then remaining somewhat consistent for the last 7 days or so. We've been about 8.3, 8.4% positive, and for our 14-day average is around 7%. The state last reported for our region at about 7.45%.
Very good. And actually, the monoclonal antibody therapeutic intervention clinic, can you go into what is that? I mean, that's, I think, exciting news is therapeutic intervention, but I'm not quite sure most of us know what that even means.
Sure. Thanks so much, Megan. The monoclonal antibody infusion is a certain medication that's been developed, which is it's basically antibodies to COVID that can be infused into high-risk individuals within 10 days of their diagnosis of COVID. And under those conditions, those folks that meet certain inclusionary criteria being high risk, either older folks or folks with significant comorbidities, it's been shown that the infusion of monoclonal antibodies will reduce the likelihood of someone requiring a hospital admission. And so it's a great medication, especially when we have scarce beds available in the facility and limited human resources also. It's a great resource to try to keep folks out of the hospital. And so there are a number of these clinics that have popped up within the Four Corners region. Some of them right up in Colorado, I think Cortez and Pagosa. And I believe that Northern Navajo Medical Center in Shiprock is going to be opening up a clinic sometime in the near future. And we've had our clinic open for months, and we've actually shared much of the tools that we've developed to operate the clinic with a lot of these surrounding facilities in the hope that we can get this needed therapy, which could really prevent people from needing to be hospitalized, out to folks in the Four Corners. So we're trying to increase our capacities locally as well to make sure that we create as much access as is possible for folks out there.
Good to know. And Dr. Greenberg, let me ask you a little bit too about these variants that we're hearing about, of course. And now I believe the Delta variant is pretty well established here in New Mexico. And I think when you test, do you get the test results back about what type of COVID the person maybe is testing positive for? Is it which variant or things along that line? Can you give us some ideas, especially what you see here in San Juan County, of how prevalent the Delta variant is? And then I guess we're hearing now about a Mu variant. I'm learning my Greek alphabet again as we go.
Again.
But can you give us some updates on Delta and then anything else that's coming down the pike that people are concerned about?
Absolutely. Well, the Delta variant really has become the dominant variant within the United States of America. And as you may remember, when we first started having these conversations, the original variant that really came out of Wuhan, China, that's what we call the wild type variant. So the original one. And then after that, we had a whole series of other variants, notably the variant that came from the UK, which was known as Alpha. That one really took the place of the wild type variant. And then there was a whole series of different ones that sort of shared the same, shared the infections kind of broadly among a series of variants. And then Delta came along, and Delta essentially has crowded out all of the other variants. And so when we do testing for COVID, locally, we test for the presence of COVID either being via antigen testing, immunofluorescence testing, or PCR testing. And that tells us if it's COVID positive or COVID negative. Now, when it comes down to variant testing, the state laboratory division does that testing, and they actually do sampling of all of the regions within the state of New Mexico, and then they perform genomic testing or genetic analysis to the different viruses, and then they can actually determine which variants are present. So we don't do that locally, but it is done on a routine basis. Now that surveillance within the state of New Mexico has demonstrated what has been also the case across the country, which is that Delta has crowded out every other variant. And so Delta really now represents well over 95% of all of the different variants that have been categorized within within the state of New Mexico, and the same is the case across the country. And so really right now, if you have COVID, you have Delta. So that is very concerning because Delta itself appears to be considerably more infectious. We also always keep track of the variants to make sure that because we're concerned about changes in transmissibility, changes in mortality and morbidity, and of course, whether or not the variants have the capability to escape any developed immunity.
That's a terrifying thought.
Right.
I just had to take a moment to take that in. And it seems, and I don't know if the science bears this out, but that Delta is hitting children in a way that the other variants did not, or maybe it's just because children are back in school in person, so they're more exposed. I don't know. But is this true? Is Delta more dangerous for children?
Well, I think that what we're seeing, let's if we could, if anyone is willing to go back into a time capsule to 2020, now might be the time. Because when we were going through this in 2020, we actually had so many different unknowns that in addition to vaccination, we had very broad-based public health measures, which helped segment some of the population and protect it from exposure. Most notably, and very importantly, not without consequence, schools were largely completely turned upside down last year. The children's exposure to COVID in general was limited considerably, and everyone was masking, social distancing. There were considerable public health orders that limited travel and certain kinds of commerce. So there was really a full court press across all of society to try to reduce transmission because we didn't know as much as we know now. Now we've enjoyed a period of time where the virus itself has waned. We've rolled back a lot of those public health measures, and it really doesn't look like we're going to be going back to those public health measures, at least at this time. And so we don't have the same kinds of layers of defenses that we did to protect against certain kinds of populations. What we do have is vaccination, which is a great layer of protection. But you're right, Megan, going back to school definitely increases the risk of transmission. We're already very familiar with how influenza spreads throughout student populations in every age group. And COVID is very similar. And Delta is indeed more transmissible, has higher viral loads. It's really important for these kids to mask and to socially distance and to wash their hands frequently. In areas around the country where schools have gone back into session without masking, there really has been a marked increase in infections in those age groups. And that has been significantly mitigated in other schools around the country where masking has been required. And so within the state of New Mexico, masking is required in the schools, and thus we're all hoping that we're seeing little to no transmission among children. But it indeed is a concern that we would see increases in the proportion of children that are infected. In other regions of the country, Louisiana and Texas, for example, new infections, I believe, were between 25 and 28% of the new infections were children. And so we're not seeing that kind of proportion at this time. There's considerable testing that's occurring within the state of New Mexico, and everyone is keeping very close eye on what happens epidemiologically with the spread among children.
Great. And one last question before we wrap up. Ivermectin, I just want to be like, Ivermectin, go. Just provide some sort of voice of reason.
Please.
Sure. So Ivermectin is a FDA-approved medication that is used to treat parasites, internal and external parasites. And when usually prescribed for approved indications, it's usually fine. People tolerate it pretty well. There's human formulations and there's also veterinary formulations that are available, but most notably those are not intended for human use. It is not authorized or approved by the FDA for prevention or treatment of COVID-19. And they have ongoing clinical trials that have not demonstrated any benefit associated with it. There are significant adverse effects associated with ivermectin misuse. The National Poison Centers have shown that there's a marked increase in the number of overdoses and misuse associated with ivermectin, and those folks do experience considerable adverse effects. And so, those poison centers really are seeing like a 5-fold increase in the number of ivermectin-related calls, and often associated with ingestion of veterinary ivermectin compounds. And those can be associated with very low blood pressures, as well as neurologic effects, things like decreased level of consciousness, confusion, hallucinations, seizures, coma, and even death. So, I mean, it also can potentiate, the effect of other drugs that cause central nervous system depression. Those are other medications you might use, like barbiturates or benzodiazepines, like Ativan or Valium or something like that. So we're seeing these case reports of these like incredibly large ingestions of ivermectin. But the thing that I really hope people understand is that ivermectin really doesn't treat anything related to COVID-19. So it is not an adequate substitute for it. I know there's a bunch of stuff that in the politicized media that talk about ivermectin and how it may be wonderful. It is just not true. The science does not support the use of ivermectin for COVID-19. If and when the science does support any medication or any approach to the treatment of COVID-19, we will, of course, adjust course. But at this time, there's all these significant side effects that are associated with this, and this really is like a folk remedy. It's like we're in the 21st century, and we're in the midst of folks taking a medication essentially designed for deworming, predominantly for veterinary sources or veterinary causes, and they're taking it to treat COVID-19. It's a little bit of a head scratcher for us, but we remain sort of ready, at least in the emergency department, looking for folks to present with adverse effects of ivermectin ingestion because they're try to take care of COVID-19. Really, if you are concerned about COVID-19, the key thing is not to take a unproven medication that could harm you. The key thing would be to get vaccinated. That's a well-studied, probably the best studied medication in the history of modern medicine at this time, with hundreds of millions of people receiving this medication with incredible surveillance and a great safety profile. If you're worried about COVID-19, get vaccinated. Don't take a medication that's designed for deworming, mostly farm animals, or the occasional use for humans for parasitic infections. So, like I said, it's a little bit of a head scratcher for us. I think that the current evidence about ivermectin is really clear when it comes to the science. So we just need to stay away from the politics, stick to the science, do the things that actually work, and avoid those things that can harm you that don't.
Very good. Thank you so much, Dr. Brad Greenberg, for joining us today. We really, as always, appreciate your time. As you stated, the ER is very busy, so we appreciate you hopping on this call.
Yes, thank you.
You bet. Thank you both, and my pleasure, and stay safe out there.
You too, Doctor. Thank you very much. That's Dr. Brad Greenberg, of course, from San Juan Regional Medical Center, joining us this morning for our COVID-19 Community Information Program, and he's scratching his head a lot, I think, these days.
Yeah, I can't even, if we're scratching our heads as a non-medical professional, I can't even imagine what the white coats are doing these days.
Right.
Scratching their heads, throwing their face into tables and doors and walls, probably.
I think the only maybe positive thing is that they're so busy they don't have time to deal with the media, so hopefully they're not seeing all the stuff that we see.
That's probably.
And hopefully.
That's probably true. They're like, we don't have time for Twitter.
Yeah. Exactly.
We're saving lives.
Exactly. Yeah. Anyway, we wanted to give you a quick update on cases here locally. Of course, we're only with you once every other week, and so just as kind of like an overview, though, of how things are going. And actually, what we found, the State of New Mexico Health Department still has that state COVID dashboard. They're still updating it. They're still putting all the new cases up there, of course. And so we wanted to share the numbers of San Juan County because it's sometimes hard to find local numbers. And this is what we can see. And as Dr. Greenberg said, the fifth wave, right, we're dealing with it. And you can kind of see it on the map, right, on the graph that I'm displaying right now, that there are 5 distinct peaks
Right.
of the cases, and here we are in San Juan County. So this graph goes up until late August, and there's a little bit of a decline, though, as you can see, and so we're hopeful that maybe we'll see how that goes.
Right.
You know?
Yeah.
I don't know.
We're hopeful. Maybe we'll see.
Yeah.
Yes. That's like the tagline for COVID. We're hopeful. Maybe we'll see.
Right. Right. But as you can see, cases are not as high as they were back in the winter.
Right.
Again, I think
Much lower,
that's thanks
right?
to the vaccine. I think a lot of our medical professionals would say,
Yes.
because of the vaccine, we're not seeing maybe as many cases, but we're still seeing an increase. And this is
Yes.
Delta. I believe it's all Delta.
Yes. Well, that's what Dr. Greenberg said.
Exactly. So we have that to share with you this morning. And then moving on, I want to share some other information too. This is the latest as of Wednesday that came in of this week of the zip codes in San Juan County. And the good news is that one zip code has moved above that 50% threshold. So 87401, Farmington.
Finally.
Way to go.
Above it, yes.
Right? Now, they were above, I believe, before they added the 12 plus, right? When we started adding the younger people in, they dropped back down below that. So this is now 3 weeks worth of readings of all ages 12 plus. So you can kind of see now we're all apples to apples, and that's where we are. However, there are still places below 50%, and that's a concern. That's why they're in red. So Bloomfield, 45.79, La Plata, 45.77% vaccination rate, and AZTEC, 38.42% vaccination rate. They are the lowest in San Juan County.
Yes.
So in order to try to get a handle on this, again, I think Dr. Greenberg would agree with us to get vaccinated. If you have concerns about the vaccine, check with your healthcare professional. That's what we always say.
Yes.
But I wouldn't say no just out of hand.
Right. No.
That's me.
Yeah.
That's just me. But I
yeah.
wouldn't say that. So there you go. Let's check and see what's next to share, because we know that there is going to be a vaccine clinic in AZTEC coming up next Thursday, everybody. So a week from yesterday, September 16th, from 4 to 6 p.m. They are having it, the Pfizer vaccine. They are going to be giving them out at the AZTEC High School Gymnasium, but it's open to the public. So you can pre-register at vaccinenm.org to reserve your dose. Again, 4 to 6 p.m. We've been seeing some of these clinics at the schools just for staff that want to get vaccinated or get tested or things along that line. But this one's now open to the public. So Thursday, September 16th in AZTEC from 4 to 6 p.m.
Yes, definitely go if you have not been vaccinated. That would be my urgent plug.
Your plea for folks,
Is my
right?
plea, yep.
Gotcha. All right. Very good. And I think that will bring us to an end of what we wanted to share this week with everybody.
That's right.
We'll be back next week. I'm sorry, but we're not done. Because
Okay.
the watch list
What's
is back.
next?
The watch
Oh,
list
the
is
watch
back.
list is back.
Remember that?
Whew. It's been
Right.
a long time.
Right? Contact tracing.
Yes.
Right? You know,
the watch
so
list.
if
Rapid responses.
Rapid responses,
Yeah.
that's right. So if a person or if an organization or a store or a place, location had more than 3 rapid responses from the Department of Health, they were on the watch list. And if they had more than 3, they'd have to shut down. And so we're not seeing more than 3 yet, but we are seeing places on the watch list yet again. And so this is from the New Mexico Environment Department. And so we wanted to just pass this along. It's updated every week, and so we'll start sharing this with everybody on our program. But as you can see, there are 2 rapid responses at the Life Care Center of Farmington. Over at FedEx and AZTEC, they have 2. The Sheriff's Office had 3.
In AZTEC.
In AZTEC. Smith's Grocery Store had 2. AZTEC High School had 2. And we'll keep going here to show you the next page. Kugler Middle School with 3 in AZTEC. Bloomfield High School with 2. Heights Middle School with 2. Farmington High with 3. The Farmington Schools Transportation Barn had 2. And there's one more page, I believe. Northeast Elementary in Farmington with 2. Piedra Vista with 3. Sacred Heart Catholic School at 2. And Tibbetts Middle School with 2.
Well, we are noticing exactly what we talked to Dr. Greenberg about, which is with schools open, transmission can run more rampant. I think most of these are schools.
Very
which
true.
is replacing nursing homes.
Right.
Which is interesting.
That is interesting.
Yeah. So.
But of course, a lot of folks in nursing homes are vaccinated, and now in schools, if you're under 12,
yes, you are not
vaccinated.
And there would be the ultimate point, right?
Right.
So, yeah.
Exactly. To protect those folks that can't get the vaccine just yet. So,
And the efficacy of the vaccine. But
right.
yes.
And true.
Yes.
That's the other point. So, good to know. But that is now what we wanted to share with you this week, everybody. So we thank you for joining us. Again, we're here every other week with COVID-19 information. We hope you'll share it if you find it's useful. We think it's important to have local folks on to talk a little bit about what's going on here locally in San Juan County, so it all doesn't come out of Albuquerque, and share that with our audiences, both online and on the radio. You know, if someone doesn't have access to Facebook or Twitter or YouTube, or stream us online, they can listen to the radio Friday mornings at 8 and get the same information.
Yes.
And that's why we do this.
So next week we're back with solutions from the street.
Another solution from another street. I can't wait.
I cannot wait.
I can't wait. That's been a great program, and we're looking forward to that. So until next week, everybody, thank you for joining us. Thanks for watching. Stay well, and we'll see you next week on KSJE. KSJE is proud to support the AZTEC Highland Games and Celtic Music Festival, October 2nd and 3rd at Riverside Park in AZTEC. Music from Big Patty, Smelter Mountain Boys, Patrick Crossing and Devil's Dram, and featuring the Highland Games Athletic Competition. Plus, Scottish vendors, food, and clans. Find out more online at aztechighlandgames.com. KSJE is proud to support the 41st Annual Cancer Walkathon. The event supports the Connolly Hospitality House in Farmington. Registration begins at 7 a.m. on Saturday, September 18th. The walk begins at 8 a.m. at San Juan Regional Medical Center. Walkers raising at least $50 receive a T-shirt. Find out more online at sanjuanmedicalfoundation.com.